our patients are heroes, and I truly feel our patients that agree to go on a clinical trial are heroes. I mean, what better way to help us get further along in our fight against cancer than to agree to participate in a clinical trial? The world of research, it really is looking. I'm really seeing a process where we ask the patients, do you mind if we obtain extra blood, or do you mind if we send your tumor block to the research facility because they are doing more studies on it? And patients always say yes, of course, draw more blood. But that is how we are getting huge advances, and we, especially with learning about gene therapy and learning about the genes, they now can test the gene of the tumor, and they're getting really good at being able to determine which chemotherapies are going to work and which are not. I mean, I can see in the future where it might be that you send off the tumor and they send back a cocktail of what it is you're going to need to do to treat that and possibly cure that cancer. That's very exciting. Instead of wasting time and putting a patients through extra side effects, knowing what's going to kill that cancer is very exciting. The other area that is really growing are not chemotherapy, but targeted therapy. We have drugs that work right on the tumor, and for instance, we have one that stops the tumor from being able to send out pathways to blood vessels, and essentially it starves the tumor. It means it can't get to where the food source is, the blood supply. And then we have others that work on proteins that the tumor likes, or hormones that the tumor likes, and that is their food. It cuts that off so it starves the tumor. A lot less side effects than the typical chemotherapy side effects. So that's very exciting. Knowing that you are making their day a little bit easier really feels good. I have so many patients that it's not the process of being on the clinical trial. I do feel excited about maybe them getting better treatment than they might have had if they didn't go on the clinical trial. And I must say, none of us here could ever get behind a clinical trial that we didn't feel comfortable about. If it doesn't feel right, we would never open that up here. We have to feel good about what we're offering patients. But it's the little things, and so many patients have said when they get through their treatment and they're done and they don't have to come so frequently, they sort of feel a little bit lost, and like they're gonna miss us, and they will say that. And just knowing that has made their journey a little bit easier is very rewarding.